Hello and welcome to another great, interesting episode of Focus on Health. My name is Omo Nyango and I'm being joined by Dr. Amanda Ngolobe from Nairobi West Hospital, a physician who is going to tell us more about meningitis, a viral infection of the protective membrane of the brain. And right now, Dr. Thank you very much for joining us.
Thank you.
Yeah, how's everything?
Doing good.
Yeah.
Yes.
So we're talking about meningitis. Basically, what is meningitis?
Meningitis is an inflammation of the lining of the brain.
Yeah.
Yes. Yeah. Can be because of many reasons.
Yeah.
Most of the time it's because of bacterial infections. Could be because of viral infections or fungal infections. Yes.
That's a very simple definition of meningitis, putting into consideration how dire or how severe it is.
Yes.
Yeah. So when we talk about severity of meningitis, what would you tell us in regards to that?
Meningitis by itself is a treatable condition, but if left untreated, can be very bad to a point of leading to death or disability, which is extreme disability.
Yeah.
Yes.
When we talk about it also, so what are some of the symptoms of meningitis? Because meningitis does not only affect children who are below 2 years, it can also affect people who are in their teenagehood. So what are some of the symptoms in regards to these two groups of people that meningitis can affect?
If you take children below 2 years, generally because they cannot voice their issues, you find that the symptoms they present with is irritability. The child cries a lot, the child looks uncomfortable, poor feeding, and there's a particular positioning of the neck they have in which they tend to bend their head backwards and they look like they're very stiff. And then of course they also present with fever. Children above 2 years of age or older children, up to teenagers and adults, they present with headache. They present with being unable to look at bright light. It disturbs their eyes. And then they also have a stiff neck. And now the same issue with the neck sometimes. When it becomes very severe, they start bending their head backwards. Yes. So
when moving away from that and talking about meningitis in infants, what do you have to tell us about meningitis in infants, and what are some of the causes of this?
It can affect infants. The causes of meningitis can be classified broadly into infectious or non-infectious.
Yes.
Most of them are infectious.
Yeah.
So the most common one in infants is bacterial meningitis. They get it when they either get what we call a respiratory tract infection or an ear infection, are the most common causes in infants. Because of the distance between their ear, their nose, and other organs inside their head, you find that it is easier for them to get meningitis from what would be innocuous infections, things that in an adult would not lead to the same thing.
Exactly.
Yes.
And you did mention about that, but when we talk about meningitis in general, so what are some of the causes in not only in infants but also in children below 2 years, and of course youths or people in their teenagehood? What are some of the causes?
Causes would be the bacterial infections mostly. You can also get viral infections, and you can get fungal infections. Fungal infections generally you get when people have a low immunity. So it's not very common if you have a proper immunity and you're otherwise okay. What we find is that in teenagers and people within that age group, the frequency of meningitis depends on whether they are in a place with many other people. Because enclosed areas have the likelihood of you transmitting it to the person nearest to you. In young children, they could be because of the same things, because they interact a lot with each other, but mostly because also their immune system is less well developed than that of adults. Adult meningitis is not as common as that in children, but it can also happen for the same reasons.
And the viral, bacterial, and fungal, are they also the types of meningitis that can be there in terms of?
Yes, infectious meningitis, yes.
So, Dr. we were talking about the types of meningitis, right? We have bacterial infections, and we realize that we have several strains. So what are some of the strains that the African region, to be specific Kenya, gets are more prone to, the children and people in Kenya more prone to which type of meningitis?
Again, also it depends on age, but for the most part, we have streptococcal infections.
Yeah.
We have Neisseria infections. We have Haemophilus infections. Sometimes you have staphylococcal infections, but they are not very common. The worst of this, I think, would be the Neisseria. Yes.
And why is this? And you did talk about the meningococcal haemophilia.
Yes.
Haemophilus with streptococcus, and also so when you talk about these, the terms are really complicated in a way. So for a viewer out there, what do all these coccus mean?
All these are just the types of bacteria that you can get. So usually you get the specific bacteria when you do something we call cultures. There is no other way to find out except for clinical presentation. So what we say that Neisseria is the most severe of them is that, one, the infection becomes worse when it happens, and it progresses very fast. So those are the ones that you would like to catch them on time and treat them very quick. The rest are also serious infections, but the progression is less faster, so you have a bit more leeway than you would get with Neisseria. Yes.
So, moving away from that, so what are some of the risk factors of meningitis?
Of getting meningitis?
Yes.
One is a low immunity.
Yeah.
So any kind of low immunity would increase you to getting meningitis.
Yeah.
Second is previous infections that you've had before. Third would be proximity to other people with the same infections. What you find is that sometimes when you get meningitis in a population like a boarding school, it spreads faster because there's more close contact between the people. So those would be it.
What about skipping vaccination in maybe young?
Yes, that is actually very important. We have vaccines for meningococcal meningitis. There are also vaccines for other kinds of infection, and they help to prevent you from getting the infection, and if you get it, they reduce the intensity of the infection.
Pregnancy in women, can also that be a risk factor in terms of maybe the food they eat?
Not usually because of the food. Pregnancy in women can go either one of two ways. Your immunity can remain the way it is, but you find in some people it goes a bit low. So when your immunity is low, there's a chance of you contracting other diseases, meningitis being one of them. It is, however, not very common. Yes.
So when we talk about this, then something also comes up, and that is vaccination and the importance of vaccination in young children. Tell us a little bit more about that, Dr.
I think vaccination in young children is very important in our setup.
Yes.
Firstly, because these infections are still there around this particular setup, as opposed to other more developed countries where they've managed to eradicate some infections. Second, it helps us to reduce the chances of getting these infections. Our healthcare seeking abilities in this country are not one of the best. Yes, we wait for too long before we take people to hospital. So if we can reduce the chances of you getting these infections, it would be much better for both the person who's vaccinated and the other children who they might come in contact with. Yes. And
when we talk about that also, so what when a patient comes in or comes into the hospital and you are the one who is going to have a conversation with him or her, so what is what is the step for diagnosis, and what are some of the things that you look out for?
In meningitis?
Yes.
When the patient comes in, usually they come in with complaints of headache and neck pain. So what you would ask them is how long the symptoms have been there. You would ask them if they are finding it difficult to look at light, if they have a fever. If it's some babies who are coming in, you ask the mothers if the babies are feeding well. You would also want to know if there's anybody else they've come into contact with the same symptoms. Also, you ask them if they have had any recent infections, usually respiratory infections or ear infections, if they have any recent episodes of trauma, because any trauma you get to the head can increase your risk of getting infections. Yes. And
in relation to that, do we have any particular test that maybe there's you conduct?
True, there are very many tests we can conduct. The first one we do is what we call full hemogram. It shows us if you have any active ongoing infection in your blood. If we suspect meningitis, in setups where we can do it, we do a CT scan of the head. It would help us first in making sure there is no other condition which could mimic meningitis, which you might be having. And then we do something we call a lumbar puncture, where we get some fluid from your back, which is the same fluid which goes all the way to your brain. And we use that to make a concise diagnosis that this is in fact meningitis. Yes.
Yeah. When you talk about all this, then something also comes in. Then the treatment. So after all this is done, so what is the treatment for meningitis?
Treatment for meningitis, bacterial is antibiotics.
Yeah.
Usually we give them for 10 to 14 days. They must be given, for the most part they are given on an inpatient basis.
Yeah.
So the patient has to be admitted and get medication through IV. Viral meningitis we also treat for almost the same duration of time, 14 days. Fungal meningitis might take a bit longer to treat.
And why is this?
Because they are more difficult infections to clear.
Yeah.
By the time you get fungal meningitis, your immunity is low, so it takes longer for you to be able to clear the infection. The treatment, ideally the acute phase is for 14 days, but it can be continued even beyond that depending on symptoms and improvements. Yes.
Thank you very much, Dr. Harris. We're now going to take a very short commercial break, and when we come back, we're going to continue the conversation with Dr. Amanda, who is going to tell us about some of the strategies that the government should put into place to make sure that this doesn't spread. But right now, I'm going to leave you with the Healthy You segment. See you on the other side of the break.